Right arm will go to shoulder height, left leg straight as possible, as much as possible, hip height. Okay, so lie prone on the floor first, belly, and stretch your arms out first. Maybe just lower the chin to the floor. Now, feet are hip distance apart, important for that. I'm going to slide my right arm out as straight as possible and bring it to shoulder height. I'm now going to slide my left leg out and bring it to hip height. And there, of course, there'll be a gap between the pelvis and the floor, and that's what I want to correct. Use a sandbag and even up the weight and place that onto the sacrum. And once you do so, let the right arm go back to where it was and the left arm straight. So because we use both the arms have to reset. Now you can turn the cheek if you want to, so left cheek on the floor or right cheek on the floor, your choice, whichever is comfortable for you. 1 minute starts here. Once you set yourself up and allow that tension, which there is considerable amount of, to start to dissipate. You know what? In other words, start to relax, especially the left leg. The arm is quite comfortable. The left leg is not as comfortable because it's in an unusual position. So relax the quads, relax the hamstring, and if you can, allow the knee to come towards the floor. And breathe. Notice the left side of your pelvis slowly coming to the floor, and that really allows that pelvis and the lower back to have that little bit of space. And of course, there's always weight on the pelvis. There's always compression on the pelvis. When we sit, we're compressing. Even when we stand, there's compression because most of us are inclined to be in an anterior pelvic tilt. Pressure onto the pelvis. If you're finding this comfortable, it means that that little space that you're seeking is actually now available. Relief. The space for relief. The decompression from the lower back and the pelvic area.